Let's discuss the clinical applications of Yang Qiao Mai or Yang stepping vessel. The Yang stepping vessel is the first line of reservoirs to absorb excesses of Yang, but it does so primarily in the head. Excess of Yang in the head can manifest in a variety of ways. For example, liver fire or liver Yang rising, affecting the head, liver wind. Absorbing excess Yang from the head also has a mental implication, as the Yang stepping vessel is used for mania and agitation. Absorbing excess Yang from the head also implies extinguishing internal wind, and the Yang stepping vessel is used for wind stroke, facial paralysis, aphasia, numbness, or epilepsy. It may also be used to expel exterior wind from the head for symptoms of aversion to cold, fever, sneezing, headache, stiff neck, runny nose, and floating pulse. It is particularly indicated if the exterior attack is accompanied by severe headache and stiff neck. The Yang stepping vessel brings Yang Qi to the eyes. The Yin stepping vessel brings Yin Qi to the eyes. When the Yang stepping vessel is full, there is too much Yang Qi in the eyes and they cannot close, so that the person suffers from insomnia. To correct this, one can drain the Yang stepping vessel by reducing bladder 62, tonify the Yin stepping vessel by reinforcing kidney 6, and insert bladder 1 to establish communication between these two vessels at the level of the eye so that excess Yang is drained away and Yin is transported to them. Excess of Yang in the head has also an implication on the mental level, and the Yang stepping vessel can be used for mania, agitation, or insomnia. A particular indication for the use of the Yang stepping vessel in these mental conditions is a pulse that is full and wiry on both front positions of left and right. In ancient texts, it is indicated in cases of attraction to ghosts and demons and missing a dead relative excessively. The 1,000 golden ducat prescriptions indicates the Yang stepping vessel for fright, seeing ghosts, and manic depression. The Yang stepping vessel is very useful to treat unilateral backache and sciatica. In channel problems, the extraordinary vessels are particularly indicated when the symptoms overlap several channels. For example, the Yang stepping vessel is indicated in sciatica when the pain affects the bladder, gallbladder, and stomach channels, or just the bladder and gallbladder. In such cases, we have to needle bladder 62 on the affected side and SI3 on the opposite side. If there is pronounced stiffness, we add the Chi cleft point of the Yang stepping vessel, that is bladder 59. After leaving these needles in for 15 minutes, we then ask the patient to turn over and we treat the local points on the back. The Yang stepping vessel is particularly indicated in back problems occurring against the background of a full condition and the pulse is full and wiry. We do not use the Yang stepping vessel when the backache is bilateral. So the Yang stepping vessel is excellent to treat sciatica when the pain overlaps among the gallbladder, the bladder, and stomach channels. Use bladder 62 on the affected side, SI3 on the opposite side, and leave in for 15 minutes, and then use local points. As the Yang stepping vessel flows through the GB29, this vessel affects both the bladder and gallbladder channels in the hip area. For this reason, we use the Yang stepping vessel to treat hip pain. In such cases, use bladder 62 on the affected side and SI3 on the opposite side. After retaining these points for 15 minutes, ask the patient to lie on the opposite side so that we can needle GB30.